All right. Thank you guys for joining the Vaccine Equity Coalition call in June. The theme today is going to be children because we have some big news to share, and then also related to a lot of the survey results that we've got helped with your help gotten collected. So today we're going to cover the survey results and some of our initial findings. We're going to talk about pediatric vaccinations, which apparently could start next week, and then some brief fundraising updates. So first on the survey results, thank you to everyone that helped share it around. We got close to 300 responses and started looking at the initial results today. And it's showing overall the efficacy of this organization and coalition working together. So we'll share some of the highlights. I will pause at certain points because it would be helpful to have context on some of these numbers. Jamal will also talk about testing and some discrepancies we're seeing inside the United States versus the border. But to start with, on the kid note, 88% can get access to the vaccine for children, and 81% feel it's safe for children. So through the many, many channels, we've reached marginalized immigrants, whether it's texting, phone, webinar, in-person, farmers markets, it's really having an effect. Additionally, 88% that feel the booster is very important. And their biggest concern as to why they wouldn't get, if they did not have a booster and why they would be worried about COVID, is their health and exposing others. So the statistics are remarkable in that regard. Of the vast majority feel it's safe for their children, it's safe for themselves to get boosted, and really shows the efficacy of this coalition. Couple of notes: we will create a blank kind of survey that anyone can use for their own fundraising awareness or impact. So the report will have all of these statistics collected together and some of the findings to basically show for other coalitions that you may be a part of related to the vaccine, because essentially we've been doing really well. For those that would not get boosted, what were some of the findings? So I'll read these out, and anyone's welcome to chime in because it's a little bit of a smattering. Again, most of the population we serve did get boosted and would continue to get boosted because, let's be real, COVID's going to be around for many years to come. There are going to be many boosters. It may very well become like the flu, where it's an annual thing. For those that didn't or don't feel it's safe, there were some financial concerns, meaning the side effects would not allow you to work. Very, very few, like less than 3%, believe that they were already immune because they had COVID. Does anyone else have any thoughts about these numbers or just what they may mean in larger parts of the communities you work with? And feel free to chat anything that you see. Masking was the next subject. So 42% are required to wear a mask at work, which just for context, the vast majority of this coalition is California based. We do have a few partners that are working in South Dakota, Texas, New York, but the vast majority of these respondents are California. I was surprised by that number, especially having recently traveled to San Francisco. I guess maybe just to call in somebody else like Panita, do you see this a lot when you go to a lot of the areas you serve, that almost half the people are wearing masks at workplaces? Like, and if you go to
Yeah, I was actually surprised myself because I actually just traveled to Minnesota last week, and it was very different here, especially in even restaurants. Like, the people who are working there are wearing a mask even when the diners are not wearing the mask and they don't have to. So people are still, in the crowded situations, because we have our vaccine clinic at a farmer's market. People are standing in line, they're pretty close together. We have a lot of people on benefits and they're wearing masks. So
yeah, it's definitely something, because Posey and I recently traveled together to Cali. I mean, again, North Bay, so California is a big place. I was surprised by how much more masking I see than I see here in the more rural part of the United States in Michigan, and probably very similar to what you saw in Minnesota. but even so, the first stat was the question was, are you required to wear a mask in the workplace? And then the second question, which is the second graph related, is, are you wearing masks indoors? And also still pretty high. Again, what my read would be is that the informations and the information that we're sending is having a great effect. Jamal, do you want to cover this one?
Thank you again for all the organization who participated in helping us to distribute this survey. For those who participated, the results were actually good because 77% of people feel they have access to the vaccine. And what happened when people do get infected? They isolate. However, we do not have a lot of insights for other organizations that were at the border, like GRM, Global Response Management, or El Ocho Lado, because there they still a very high need of testing kits, because it is like for immigrants who be able to cross at the border, they must have a negative test. And it is just like unfortunate that we do not have a lot of insight to what is going on the other side of the country.
Yeah, and just a quick language, right? You mean 77% access to the testing kit, not the vaccine?
Yeah, like the testing kits.
So we do have partners that work on the border, and as Jamal said, a negative proctor test is required for entry. With the recent change in travel, that you no longer have to have a negative test to travel in if you're just as a tourist or visiting family, that will probably change. We still get the weekly reports and can show that testing is still really high. I think that was, oh, that's when my internet went out. I'll show it at a different time. But essentially, from the weekly reports that we're showing, there is still a really high number of testing. And I think when this coalition started, that was not expected. We weren't tracking anything about testing kits. But from the perspective of a needs-based assessment, the access to the testing kits is by and large there. Anyone have any thoughts or comments if they've seen otherwise? All right, so as for the big news and where the focus will be for the coming months is pediatric vaccinations for the 0 to 5-year-olds should be finally here. So as of yesterday, and Jamal can share the article that released this information, which I'm sure we'll start seeing on more media, the White House and the White House is expecting that vaccinations can start as early as Tuesday. So the FDA has now approved both Pfizer and Moderna for 0 to 5-year-olds, and they've actually released the final data, and it does show Pfizer is the way to go. And it's a remarkable difference. So the data is actually split into two between 0 to 2-year-olds or 2 to 4-year-olds. And so Pfizer's is far more effective on both counts, especially me having a 3-year-old daughter. I will do whatever I can to make sure she can get the Pfizer vaccine, even if that probably means travel. Not travel like very far, but like, driving. I'm not going to, take her anywhere, but it's just such a big difference. The FDA did say, look, Moderna is better than nothing. And younger children do have a higher just overall resilience system to COVID. So it's still approved. And I don't know, has anyone received any information of like getting access to vaccines? Like I know, Panita, you've done with Thai CDC many.
Yeah, so I actually took my daughter to get her vaccine on Monday. She's 10 though, so that had been approved for a while. I don't see any, shortages. So when we have folks coming to our clinic, they have options, and I think a lot of other places have the options, so they'll ask you what you would like, or they'll, with ours, because we had already started on Pfizer, they just went ahead and gave her another Pfizer, but I think the preferred already is Pfizer.
And do you or any other organization actually plan to do any organized vaccination drives to be able, or is it more just circulating the information at this point?
Hi, Hi there, it's Chancey from Type CC. So I was talking to our lab partner, Passport for Health, yesterday. We're all geared up to start administering the vaccination for under 5-year-olds at the end of this month. They basically are waiting for their supply of vaccinations, which they should be receiving next week. So we're going to gear up. I've got staff basically developing all the social media messaging to post, as well as developing the flyers to disseminate and ads to place in the Thai papers to basically get folks out with their babies, the 0 to 5, and get the vaccination there. And we'll be able to do both Pfizer and Moderna. Now, the other thing is I was in a convening with CDC on Zoom, and their data showed that by far the majority of the parents will probably bring their babies to get their vaccination at a health care provider, like with their pediatrician, more so than at a clinic, at a pharmacy, or like basically a community site.
Which makes sense given the fragility, right, of it's one thing for an adult to show up at a farmer's market or just some sort of conference hall and say, just give me a jab. And it's another thing with a 1 or 2-year-old. That definitely makes sense. It's also just good to know that when you see something in the media, it's actually can be validated. Like, look, we actually will have access to this boosting regimen or vaccine regimen as early as next week. And to be clear, there's one thing I didn't mention for those that just are interested. Pfizer is a 3-shot, very small, like the actual amount of the vaccine is much lower, and Moderna is a 2-shot. Also both of a lower concentration than the 5 to 18-year-old or adult shots are. I think just one thing for people to consider, because this was definitely my case here in a more rural area, is we would have also preferred to be able to go to my daughter's 3 to her pediatrician, but because there's not enough of a population here and you have the refrigeration and all that aspect, the pediatricians struggled to keep up a supply. That will most likely not be the case for the first month. So getting all the messaging out, whether it's in newspapers, text, webinars, etc., do it now. It seems legit. I mean, this was just breaking as of yesterday, but thank you, Chancey, for validating it that it's available in your area, because the supplies will be sent in a month or two. Then it'll become too difficult potentially in rural areas. Given I've heard that quite a bit too from other rural. Any other comments or thoughts from other people on what they may be hearing or seeing? All right. So last topic, and then we will wind it down, is fundraising. Essentially, my view, and I've talked about this with a couple of other people, is the pediatrics and the testing is probably going to be the final mission of this coalition. We had at the beginning of year, if you remember, then we were under the wave of Omicron, which, by the way, just to be clear, one of the things that delayed the pediatric release was accounting for Omicron. And all of these stats shown here include Omicron and the BA2 variant, meaning that this efficacy not only includes the previous strains, it accounts for those most recent outbreaks because they were so large. Anyway, going back to fundraising. So at the final point where we were in February, we did have 3 foundations considering supporting and amplifying our efforts. That has now since languished. And it shows of the overall things we're seeing societally, with no longer having to show a negative test to visit, being out in the schools, reducing masking requirements, etc. They are still considering. This would be the final need that I could see for this coalition, this being pediatrics and really making sure our efforts are amplified. For those of you that know fundraising well, a sense of urgency and a need immediately is a very powerful tool. It is honest in terms of it is needed because of the getting this information. It's the kind of the last mile. It's 20% of the population of 0 to 5-year-olds, which would really help us hit the herd immunity. Well, I think at that point we can wind it down. No immediate next steps needed. We will do the final reach out to the 3 existing funders to see if this coalition will continue. If not, potentially our next call might be a goodbye call and a mission accomplished, when we'll share all the informations and meaning like this vaccine survey. We have a lot to be proud of. And it was just an honor to work with you guys on all this. We'll see. We may still continue, but at this point, mission is beginning to look accomplished.
Oh, also, I want to share with everyone that President Biden, in his statement last week, mentioned CDC around our vaccination efforts.
Congrats.
Amazing.
Big time.